This demonstration is going to be for the Conterra XXX spinal immobilization system. And a lot of folks use a shorthand term saying that they're spider straps, but they really aren't. They are a Velcro style immobilization system. Now, our straps are meant to be attached to the bottom of the board, that way we don't lose them. And they deploy by simply grabbing the strap and pulling it outward. There's a central spine on this strap that is a reflective strap, and the reason why we call this the XXX has nothing to do with pornography. What it has to do with is that there are 3 X's that correspond with the 3 major weight systems of the body: the chest, the pelvis, and the lower legs. And these straps slide up and down to meet the size of the patient. And the way we do this is we are going to put the label at roughly CPR position. And then we're going to affix from the head down softly and then tighten from the foot up to the head. When we're all tight onto the board, then we can go ahead and affix the head to the board, and then we can let go of manual stabilization and let the board take over. So you'll notice that on these straps we have D-rings here that allow these straps to hinge a little bit, because some folks have big wide shoulders and some folks have shoulders like a brook trout, and we have to be able to adjust for that, because these straps also act as deceleration straps. At some point this patient needs to get inside an ambulance or an aid rig, and we have to be able to protect the head from the mass of the body in a deceleration, and that's what these help to do. So we're going to start with that. We're going to have our assistant here grab these. We're going to peel them open. Then we're going to run these through the board. And you can take your choice about whether or not to attach the arms within the straps, but the patient is going to be better protected if the arms are outside and the straps are actually in contact with the torso. So what we're going to do is grab like this, and then we're going to watch each other, and we're going to pull and lay down. Perfect. Now we have the upper torso affixed, and so if the patient needs to be moved in an emergency or needs to be rolled in case the patient vomits, we at least have a heavy portion on the board attached. All right, we're going to do the same thing here, and we're going to put this one just about pelvic bone, right about there. And then we're going to let the straps dictate what holes we put them through. Pins in the way. Okay. All right, you ready? And we pull down. Now this third one is a little counterintuitive. The knees are usually a spot that we don't want to have anything to do with when we're doing straps under tension. But if you notice, these straps don't actually push on the knees, they encompass the knee joint. And they work very well that way to help the lower legs stay put. I'm going to go to this one. Yeah, I think. See how it goes. Just right about there. Okay, give a little pull. All right, at this point, we're affixed, and all we need to do is tighten. Sometimes, especially folks with large boots on, you'll want to tape the toes together if the injuries will allow it. So now what we do is we're going to tighten foot to head. So we give a good hard tug here. We nice and tight. And we do the same thing here. Good hard tug. And then one last one.
Take a deep breath.
And that's it. Now that we've gone from the foot tightening up to the head, we can affix the head, we can tape the thumbs together, and we have a proper immobilization, and we have lots of strap to body contact. So this patient's really well protected.